next one is going to be called the OpenBasketweave. This is a tape job that's strictly for compression. Does not support the ankle very much at all. So again, we want to prep them with spray. Just going to do it very lightly because he's already got some on him. Alright, so the key thing with this is to leave an open gap all the way up and down the anterior leg and the foot. So we're going to have to lay some strips, just like we would with our normal tape job, but we want to try to leave it open just a little bit. So we're going to lay at least 3 or so. I'm overlapping slightly, but that's not a big deal. Because what this does is this allows the swelling to move to the top of the foot, or the anterior aspect. It'll actually get rid of the edema or the swelling a little bit quicker. So again, we keep our strips overlapping by half. Then we go down into, you want to go as far down the toes as you can, because swelling is always going to move as far down the foot as it possibly can, even into the toes. So we want to actually run this as far down as we can. I'll lay a couple strips for anchor points. Again, this is going to be very similar to the previous ankle tape job. If we can keep them in dorsiflexor position, we want to, but this may be painful depending on how bad they're injured. So again, we're going to try to pull lateral or medial to lateral using the same technique, going just behind the malleoli, coming around, make sure it's good and attached. And my victim's already shaved themselves, so the pain is going to be less taking this off. Okay, and then we're going to alternate with the horseshoe and the stirrup. I've already laid one stirrup, now I'm laying my first horseshoe. Now this is going to be slightly painful if someone has a true ankle sprain. It's not going to be very comfortable to yank them around and lay the tape down. So you have to take that into consideration too, whether you really want to do this tape job or not. Again, we now alternate horseshoe and stirrup, and you can use the exact same technique when you're using a regular give-knee closed basket. But again, this is the open. So we just keep laying strips alternating between horseshoe and stirrup until we've got it fairly well closed up. And we want to try to keep that top as open as we possibly can. Try to lay as, in this one we can go more than three strips each direction. We can go as many as we need to, because the whole point of this is to just close it up as best as we can to try to get just a gap left at the very top of the ankle. So again, here we're coming around. Okay, I'm pretty much gone as far as I can with my stirrups. My horseshoes I can continue further. So what I'm going to do now is I'm going to start at the plantar aspect of the foot, and I'm going to close going from the bottom of the foot all the way up the back of the leg. This way we help squeeze the swelling up towards the heart, because that's how you want to get rid of the swelling. So again, I'm going to lay strips that just come around, hopefully don't overlap each other. Got close there, but not quite. Okay. And we just keep laying these strips up. Okay, I've gone as far as I can basically there. So now I go back to moving up the leg. There's some overlap there, but that's okay. Again, if there is some overlap, that's not too big a deal. Just want to make sure. The reason that we leave this open as well is this person can take this off a whole lot easier. They can remove it without having to use scissors. Okay, so now we basically have the open slot all the way up and down. So now all we're going to do is lay some strips to help keep those individual strips all together. So you can use smaller strips. And we're just trying to keep all those tail ends kind of tied together. So I'm just going to lay a couple strips there. do the same thing on the opposite side. Again, it's just to hold everything kind of together so it doesn't completely fly apart. If you got somebody that's extremely hairy, you may actually want to use pre-wrap on them or make them shave, one of the two. Okay, now what this is going to do is this is going to allow it to actually spread apart. The book actually shows a couple more strips just to hold everybody from completely popping apart. Do that. That. And then one more. And then, to final wrap everything off, is to cover it with a ace bandage. And again, if this person's wrapped too tight, they're going to have cut off circulation. So you want to make sure that they know that if they feel excessive numbness or tingling, that they need to take the ace bandage off, and that still doesn't help. They'll need to actually remove the whole works so they don't lose circulation in their foot. Again, we always wrap from distal to proximal to help get rid of the swelling. And we'll put the, actually I'll just lay tape over it like the normal would, because the clips fall off anyways. And there we have it.